Dear friends, now in our previous videos we have discussed regarding management of diabetes and its different aspects, and first we have discussed self-monitoring of blood glucose and how you should check your sugar levels and what are the normal ranges. Now first important thing in management of diabetes when you are being diagnosed with high blood sugars in pregnancy, first important thing doctors tell you regarding your lifestyle management. So you should do a proper dietary management and exercise. You should follow a proper exercise pattern. So in this video we are going to mainly focus on important tips for diet and exercise during pregnancy, and which you should follow and control which will help to control your sugar levels in pregnancy.
Now let's discuss some of the tips to manage diabetes in pregnancy. First, we will discuss about the dietary management. So in that, we will discuss some important tips. So you should have small and frequent meals, as having small and frequent meals leads to a healthy weight gain, and it also helps to control your blood sugar levels in normal range. You should prefer fiber and protein-rich foods in your meals, and especially as a mid-morning and mid-evening snacks, such as salads, fruits, buttermilk, nuts, etc. So these fiber and protein-rich foods take longer time to get digested, and so your sugar level increases slowly. So prefer these fiber and protein-rich foods in your regular diet. Then you can prefer light snacks which will not increase your sugar level, such as Khakara plus sprouts, then Rajgira, Jowar or wheat puffs as your evening snack options. In dry fruits, avoid dates, dry figs as they increase your sugar levels. Prefer these when your blood sugar level is on lower side, that is less than 100 mg per dl. Otherwise prefer other dry fruits. Then take a good combination of complex carbohydrates, proteins and fibers in your meals. So sources of complex carbohydrates are whole grains and cereals like Daliya, brown rice. So you should prefer these complex carbohydrates. You can prefer wheat flakes, muesli, oats, especially rolled oats as options for your breakfast. Then sources of proteins. For non-vegetarians, you can prefer eggs, chicken and fish. For vegetarians, you can prefer milk and milk products, pulses, sprouts, nuts as protein sources. Then sources of fibers include green salads, sprouts, fruits, green leafy vegetables. So you can prefer these options and control your sugar levels in normal range. Then you should take one cereal at a time in your meal, as either chapati or bhakri or rice. Do not take two cereals at a time, like do not take wheat or chapati as well as rice or bhakri as well as rice in your meal. It will increase your sugar level. So take one cereal at a time, and with that take a good combination of proteins and fibers. If you are overweight or obese, then prefer low fat foods such as low fat or skimmed milk, then egg white, chicken, fish, especially in grilled or steamed form, then soya paneer in your diet. So avoid high fat foods, fried and oily, spicy foods in your diet, because this will lead to a healthy weight gain. Then you should prefer low glycemic index foods in your diet. So you can refer to the chart given below. So the foods which are in green zone, you should prefer them, and foods which are in red zone, you should avoid them. So you should follow the signal method. So you should avoid the red zone foods and prefer green zone foods. Now we have discussed about dietary management. So during pregnancy, rigorous exercise is not allowed, but you should do regular exercise as per the advice of your gynecologist, and prefer walking. So walk for 15 to 20 minutes at a time, at least twice or thrice a day, so that You can walk around 30 to 45 minutes in a whole day, and you should divide that time. You should not walk at a stretch for 45 minutes, and you should not prefer doing any vigorous kind of exercises in pregnancy, but definitely you can prefer walking and other exercises during pregnancy.